and the plan that has been also outlined by the Secretary of State for Health yesterday here, where he spoke very clearly about the measures and the steps that are taking place around PPE. I think it's worth noting, certainly for viewers at home, is that absolutely the government is working across every single agency that they would expect us to work with. Health and Safety Exec, Public Health England, various groups and organisations within the supply chain. We are also working to do exactly that in terms of procuring PPE for other aspects of public services too. So police, fire, certainly something that Martin and I have been working on over the last 4 weeks, and ensuring that we have not just the distribution but the supply chain. And we already know that certainly from a police and fire perspective, and this links over to prisons and other key public services, we've absolutely secured our supply chain. Every single aspect of public service requires different guidance around PPE and also different types of guidance, and that's exactly what we've all been working through. Was there anything else you wanted to come back on?
Well, would it be possible to give a commitment to a date by when the right quantities will reach the right people? Because every day we hear from certainly NHS frontline staff that they don't have the equipment that they need.
Sure. Well, I think, David, look, I mean, I can't speak for every single strand right now of public services and PPE, but the plan has been outlined, certainly by the Secretary of State for Health and Social Care. But from a policing perspective, you know, we're already out there in terms of making sure that we have enough gloves, face masks, and a substantial supply chain as well, with already 1.5 million gloves and masks in the pipeline for distribution. So this is about various aspects of various services, whether it's policing, fire, prisons, the NHS. Of course, the NHS is the priority right now, which is why we're asking people to stay at home. But at the same time, as Stephen has outlined, and also the Secretary of State for Health and Social Care, there is a clear plan. We're working with not just suppliers, but manufacturers to really bolster and boost the supply that we need for PPE, which quite frankly is unprecedented during this crisis. Can I move on to the next question, please, which is Igo Gilmore from Channel 4.
It's a question for the Home Secretary. Home Secretary, will you apologise to NHS staff and their families who've told us it's the lack of necessary PPE that's led to preventable mass infections and many deaths?
Well, I think look, absolutely, we are focused as a government across all departments to make sure that everyone in the NHS has everything they need in terms of resources and equipment. And PPE is at the heart of that. Obviously, it is absolutely at the heart of protecting everybody who is working night and day right now to save lives and prevent further deaths. Now, as you've already heard from Stephen, you've heard from the Secretary of State for Health and Social Care as well over a number of occasions, and just standing here yesterday, that there is a clear plan when it comes to PPE in the NHS. There have been distribution issues. Those issues have now been addressed through working with the military, the MOD, who are absolutely triaging and getting the supplies out to the front line. But at the same time, there is an enormous effort, a Herculean effort right now, in terms of bolstering up our manufacturing capability and capacity. We've already heard Stephen refer to some big companies such as Rolls-Royce and also Burberry, who are upping their own production and stepping into this area. So our priority is absolutely to make sure that they are equipped, they are resourced in the front line of the NHS. And what I would say to you is that this government and all colleagues are committed to doing that, and we are working day and night. We're bringing in new resources, new support staff, the MOD, other government departments, working with new businesses and other partners to make sure that not only can we get the supply out to people, but that we're also boosting our own supplies and demands in our own supply in the UK.
But no apology, Home Secretary, for these failings which NHS staff and their families blame on the government.
Well, I'm sorry if people feel that there have been failings. I'll be very, very clear about that. But at the same time, we are in an in an unprecedented global health pandemic right now. It is inevitable that the demand and the pressures on PPE and the demand for PPE are going to be exponential. They're going to be incredibly high. And of course, we are trying to address that as a government. And I think that is right. That is our priority. Matt Hancock, as Secretary of State for Health, has spoken about this repeatedly through the plan that he has outlined, and obviously the ways in which we want to do much more to manufacture our own PPE in this country, while we also boost our own supplies from overseas partners and countries where more PPE is coming into the country, but also ensuring that the distribution, which is unprecedented right now in terms of healthcare settings, whether it's hospitals, GP surgeries, care homes, everyone needs that PPE on the front line, and everyone is working to achieve just that, whether it's through the Department of Health, through the Cabinet Office, through Public Health England, through health and safety, through the guidance and the resources that we're trying to get out there.
To be clear, you are apologising for the lack of PPE, which has led to mass infections and deaths of several nurses and doctors.
I have been very clear in what I have just said, and, you know, I'm sorry that people feel that way. But I do want to say at the same time that we are doing everything within our power and our means to ensure that we can boost our capacity when it comes to PPE and to make sure that we can get capacity, PPE out to the front line in the NHS. Thank you. Can I go on to our next question now to Ed Malnick from the Sunday Telegraph?
Thank you. Home Secretary, given the rising levels of unemployment under research today suggesting that 3 million people are going hungry as a result of the pandemic, to what extent are you concerned about the wider negative impact of a prolonged lockdown? And Mr. Hewitt, there have been suggestions of a possible ban on outdoor exercise if the current rules aren't followed properly. Would that be enforceable?
So, Ed, first of all, in response to your question, of course, across the whole of government, you know, we are absolutely conscious of the level of vulnerability in society. And you've already heard me speak this afternoon about, you know, categories of individuals who need support from government. But you have spoken about the economic impacts and the economic long-term socio and economic consequences and impacts of this virus and the impact this virus is having on society. The fact that we are putting forward and we have very, very restrictive measures, stopping people from going into work, but also a huge impact in terms of where we're seeing staff being furloughed across various businesses and things of that nature. I think first and foremost, it's important for everybody to recognise that there is government support and there is financial help and support for individuals and people that need that help. There's the measures obviously through DWP, but also for businesses as well, through the Department of Business and through the Treasury. Now, when it comes to the long-term situation, none of us can stand here today. It'd be wrong for us to do this, to stand here and speculate in terms of when restrictions might move, when they would be lifted, because this government, and rightly so, is following the scientific advice through SAGE, which meets twice a week, to look at the type of measures and the approaches that we're taking as a government. But I think, Ed, the most important point for me to make right now is if people need help and support from government, financial assistance, support for their families when it comes to catering for basic bills and food, then absolutely, whether it's through MHCLG, through not just the shielding work, but local government work, getting food out to communities and distribution, but also through the financial support the government has put in place, that help is there. And I would urge anybody that needs that help and support to get in contact. Martin.
The measures that were put in place clearly to save lives and to stop transmission of the disease. It's very clear within those measures that exercise is permissible, and the reality is, as I've said, the vast majority of people are adhering to those measures.